Good afternoon. Today we are discussing the assessment of my target student, Owen. Owen is a 15-year, 2-month-old male with a diagnosis of specific learning disability. His parents divorced when he was 5 years old due to domestic violence from his father towards his mother, which his mother also endured while she was pregnant with him. Owen attended preschool in the United States for 2 years. His education in the United States was interrupted when he left the country at the age of 5 and went to Jordan, his mother's home country. Upon his return from Jordan, he was recommended for retention for kindergarten and first grade. Owen is described as a kind, caring student who works hard and is eager to please. He has a few good friends and thoroughly enjoys playing video games. He currently lives at home with his mother, 25-year-old sister, 22-year-old brother, 20-year-old sister, and 14-year-old sister. The home language is Arabic. His mother does not speak English, therefore Owen's older sister translates any documents sent home and participates in the IEP meetings as well as any other meetings held at school for Owen. Currently, his second older sister and brother are in college. His youngest sister is in 9th grade. On April 15, 2015, Owen was referred to the child study team for his school at the time, which is PS number 9 in Paterson, New Jersey. He was in 4th grade. On July 29, 2015, Owen was found eligible for special education and related services under the eligibility category of specific learning disability. For related services, he received speech and language therapy 2 times per week in a group no larger than 5. The least restrictive environment that he was placed in was a general education classroom with both in-class and pull-out support for English language arts, math, and speech and language therapy. On April 16, 2019, during the annual review, the prior recommended special education services stayed intact with exception of related services. The related services of speech therapy was reduced to 1 time per week for 40 minutes. Owen transitioned into the Fair Lawn, New Jersey school system entering 5th grade. His current placement is with a self-contained program as the least restrictive environment that will meet his academic and social needs. He is presently enrolled in the Language Learning Disability Program for reading, writing, math, science, and social studies. Owen is enrolled in general education classes for his remaining classes. The benefits provided in Owen's current program include a small class setting, multisensory approach for learning, and the opportunity for more individualized attention. These factors provide him with a learning environment that offers minimal distractions and allows him to work at his own pace. Furthermore, he is able to receive the social benefits of a general education classroom when he is mainstreamed for extracurricular activities and specials such as music and art. Therefore, between 40 to 79% of the school day will be in the presence of regular education students. For the adaptive subtest, the adaptive section of the test examines Owen's self-care skills and personal responsibilities. He scored a developmental quotient of 92, which is within the average range. His score falls in the average range in the conceptual, social, and practical scales. Owen's strengths are that he is kind, caring, and hardworking, and works nicely with others. For his personal social skills subtest, it assesses Owen's ability to interact with others and also helps us understand how he sees himself. He scored in the average range on the social scale and the happiness and satisfaction scale. However, he scored in the low range in the category of general self-appraisal that acknowledges more negative aspects of himself than positive ones. He also scored in the very low range on the freedom from anxiety scale and the intellectual and school status scale. Owen's strengths in this area are that he has friends in and out of school, he interacts appropriately with his peers, and expresses that he is happy at home. Owen's needs in this area are that he may benefit from engaging in language development tasks, which would develop his working vocabulary and foster an increased understanding of synonyms and antonyms as well as clarification and generalizations. Cognitively, Owen was provided the Wechsler Intelligence Scale for Children. It's an intelligence test that measures the child's intellectual ability. It produces a full-scale IQ that compares a student to other students their age. According to the Wechsler Intelligence Scale for Children, Omar's IQ is 74, placing him in the 4th percentile, which falls in the very low range. The Verbal Comprehension Index measures the ability to use and understand words and evaluates general language ability. Owen's score of 78 places him in the 7th percentile, which falls in the very low range. His comparative reasoning skills and verbal abstract reasoning skills are below average for his age. His knowledge and word meanings and verbal expressions are also below average for his age. The Visual Spatial Index measures the ability to evaluate visual details and to understand visual spatial reasoning. His score of 89 places him in the 23rd percentile and falls in the low average range. His ability to analyze and synthesize abstract information falls below the average range. The Fluid Reasoning Index measures the ability to detect the underlying conceptual relationship among visual objects and to use reasoning to identify and apply rules. Omar's score of 79 places him in the 8th percentile and falls in the very low range. Owen's fluid reasoning ability suggests that he may experience some difficulty identifying important information and or linking this information to abstract concepts in order to solve problems as compared to others his age. Owen's visual spatial information processing and conceptual reasoning are average for his age, while his nonverbal quantitative reasoning abilities are far below average for his age. The working memory measures the ability to register, maintain, and manipulate visual and auditory information in conscious awareness. His score of 85 places him in the 16th percentile, and it falls in the low average range. Owen's performance on working memory tasks suggests that the registration, maintaining, and manipulation of newly acquired information with conscious awareness may be challenging for him at times. Furthermore, concentrating and attending to information presented to him may be a challenge due to working memory weakness. His visual processing and nonverbal memory are below average for his age. The Processing Speed Index measures speed and accuracy of visual identification, decision-making, and decision implementation. His score of 80 places him in the 9th percentile, falls in the low average range. Owen's short-term visual memory and visual discrimination skills were below average for his age. He scored in the average range in areas of visual motor coordination, visual scanning ability, and cognitive flexibility. His ability to quickly identify visual information, make decisions with accuracy and speed, and implement those decisions at a quick rate is lower than his peers, which would make it difficult for him to keep up with writing tasks in the classroom. One of his strengths is that he shows the average ability in visual and spatial reasoning. His needs, however, is that he may benefit from engaging in language development tasks, which would develop his working vocabulary and foster an increased understanding of synonyms and antonyms, as well as classification and generalizations. In communication, Owen underwent a speech-language evaluation. Throughout this evaluation, he was compliant. The clinical evaluation of language fundamentals was administered to assess receptive language skills, which refers to understanding what is told to him, and expressive language skills, which is the ability to express himself and his needs. Results revealed below average performance in both receptive and expressive language. Scores from the comprehensive assessment of spoken language were scattered. In other words, Owen performed within the average range on the antonym test, non-literal language test, and the inference test. However, he performed below the average range on the meaning from context test. His strengths. Owen has the ability to formulate sentences, comprehend short passages, define words, and in his understanding of semantic relationships, and has notable strength in his reasoning skills. His needs. He needs continued support to determine relationships between words, restate sentences, and reconstruct sentences. In his academic performance, Owen was administered the Woodcock-Johnson test of achievement to assess his current academic performance. In basic reading, Owen's performance was reported to be within the low average range, earning a standard score of 88, placing him within the 22nd percentile. Owen demonstrated average performance with his decoding of unfamiliar nonsense words. In reading comprehension, Owen earned a standard score of 71, placing him within the 3rd percentile. The score falls within the low range. Owen struggles to use contextual clues to decipher implied meaning. Owen's reading fluency skills were reported to be within low range, earning a standard score of 75 and placing him in the 5th percentile. Weakness with Omar's word identification skills impact his ability to read fluently. On the math calculation testing, Owen's scores were within the low average range. Omar earned a standard score of 84, placing him within the 14th percentile. His performance on the fluency measure was average. His performance on the calculations portion was slightly outside the low average. Owen's written expression was measured to be within the low range with a standard score of 72, placing him within the 3rd percentile. Omar had difficulty responding to writing prompts with precision. Organization and grammar were also areas of weakness. His strengths. Owen is able to formulate basic sentences when provided specific, concrete criteria. His needs. Owen will benefit from receiving concrete examples of concepts before teaching the abstract, as well as concepts presented in a smaller amount, allowing time for processing the information. This concludes the explanation for the test results for Owen.